Hi everyone, I welcome you all for this Nursing Wisdom channel. Today we are going to see about OBG MCQ for nursing competitive exams. First question, the sagittal sutures lies between option A, occipital bone and two parietal bones, option B, parietal and frontal bones, option C, two frontal bones, option D, two parietal bones. Sagittal suture. The sagittal suture, also known as the interparietal suture and the suture interparietalis, is a dense fibrous connective tissue joined between the two parietal bones of the skull. So here the answer is option D, two parietal bones. Next question. A PRIMIGRAVIDA patient is admitted to the labor delivery area. Assessment reveals that she is in early part of the first stage of labor. Her pain is likely to be most intense at option A, around the pelvic girdle, option B, around the pelvic girdle and in the upper arms, option C, around the pelvic girdle and at the perineum, option D, at the perineum. In pelvic girdle, there will be increased pressure of presenting part during the labor process. So here the answer is option A, around the pelvic girdle. Next question, drug of choice for the management of eclampsia is option A, sodium nitroprusside, option B, magnesium sulphate, option C, dopamine, option D, labetalol. Magnesium sulphate is the drug of choice for eclampsia. It reduces motor end plate sensitivity to acetylcholine and thereby reduces neuromuscular irritability. So here the answer is option B, magnesium sulphate. Next question, SEEMA at 24-week POG comes to ANC with complaining of edema in the legs. On examination, her BP found to be 145 by 95 and urine suggestive of proteinuria. What will be the probable diagnosis? Option A, pregnancy-induced hypertension. Option B, preeclampsia. Option C, eclampsia. Option D, malignant hypertension. Edema, hypertension and proteinuria in the ANC period is suggestive of preeclampsia. In this condition, BP will be of at least 140 by 90 mm of Hg, pitting edema over the ankles and urine suggestive of proteinuria. If this condition further complicated by seizure attack, then it is known as eclampsia. So here the answer is option B, preeclampsia. Next question, acardia is option A, absence of cord, option B, lengthy cord, option C, short cord, option D, twisted cord. Acardia means absence of umbilical cord, also known as absence of the umbilical cord syndrome. It is a fatal condition resulting from maldevelopment of embryonic body folding and is associated with multiple congenital defects. So here the answer is option A, absence of cord. Next question, what is velamentous placenta? Option A, fibrous ring present at the margin of placenta. Option B, placenta is thin and large. Option C, cord is attached to the membranes. Option D, cord is attached to the margin of the placenta. In velamentous placenta, the cord is attached to the membrane. So here the answer is option C, cord is attached to the membranes. Next question, one or more lobes of the placenta placed at varying distance from the main placental region is known as option A, placenta succinct, option B, placenta extracoriolis, option C, placenta membranaceae, option D, battledore placenta. Placenta succinct. In placenta succinct, one or more small lobes of placenta size of a cotyledon may be placed at a varying distance from the main placental margin. So here the answer is option A, placenta succinct. Next question, aspermia means option A, decrease of semen, option B, increase of semen, option C, absence of sperm, option D, abnormal motility of sperm. Aspermia means failure to produce semen or absence of sperms from the semen. So here the answer is option C, absence of sperm. Next question. Polyhydramnios is a condition when the amniotic fluid volume exceeds more than dash ml. Option A 1000 ml, option B 1500 ml, option C 2000 ml, option D 2500 ml. When the amniotic fluid volume is more than 2000 ml, it is called as polyhydramniosis. If the fluid volume is less than 200 ml, then it is known as oligohydramniosis. So here the answer is option C 2000 ml. Next question. Most commonly performed test for assessing the adequacy of sperm is option A sperm morphology, option B sperm motility, option C sperm count, option D semen volume. Sperm motility is the most significant criteria when assessing male infertility. As per WHO, 1 ml of semen contain 15 million sperm. So here the answer is option B sperm motility. Next question. Vulva is composed of option A vagina, uterus, cervix and labia majora, option B clitoris, vestibule and foregut, option C labia majora, labia minora and clitoris, option D cervix, uterus and ovary. The vulva is consist of mons pubis, labia majora, labia minora, clitoris, vestibule and perineum. So here the answer is option B clitoris, vestibule and foregut. Next question. Fundal grip helps to find out option A to know the fetal part at the fundus, option B to assess the degree of flexion or attitude, option C to have an idea what the fetal presenting part is, option D to know if engagement occurred or not. The fundal palpation is done facing the patient's face. The whole of the fundal area is palpated using both hands laid flat on it to find out which pole of the fetus is lying in the fundus. Broad, soft and irregular mass suggestive of breech. Smooth, hard and globular mass suggestive of head. In transverse lie, neither of the fetal poles are palpated in the fundal area. So here the answer is option A to know the fetal part at the fundus. Next question. Most common site of ectopic pregnancy is option A tubal, option B ovarian, option C abdominal, option D cervical. Ectopic pregnancy. Ectopic pregnancy is a condition in which fertilized ovum implanted outside the normal endometrial cavity. Most common site is fallopian tube, 95%. In the tubal pregnancy, ambula is the most common part, 70%, followed by isthmus, 12%, and interstitial, 2 to 4%. Ovarian ectopic pregnancy is 3% and abdominal is 1%. So here the answer is option A tubal. Next question. Most appropriate method for abortion in the first trimester of pregnancy is option A mifepristone and misoprostol, option B prostaglandin, option C intrauterine instillation of hypertonic saline, option D vacuum aspiration. In the first trimester, mifepristone and misoprostol is the appropriate method. Prostaglandin, intrauterine instillation of hypertonic saline and vacuum aspiration are required in the later trimester. So here the answer is option A mifepristone and misoprostol. Next question. Indication for termination under MTP ACTIS. Option A to save the life of mother, option B social indication, option C eugenic, option D all the above. To save the life of mother, social indication and eugenic or indications for termination of pregnancy under MTP Act. To save mother means if the continuation of pregnancy causes serious or life-threatening complication to mother. Social indication means to prevent grave injury to the physical and mental health of pregnant woman. Eugenic means when there is risk the child born with serious physical and mental abnormality. So here the answer is Option D, all the above. Next question, identify the natural method of contraception among the following. Option A, rhythmic method. Option B, coitus interruptus. Option C, breastfeeding. Option D, all the above. Natural family planning methods, they includes calendar or rhythmic method, standard day method, basal body temperature, cervical mucus method, symptothermal method, ovulation awareness method, lactational amenorrhea method, withdrawal or coitus interruption method. So here the answer is option D, all the above. Next question, CHOLASMA will appear on dash body part. Option A, breast and nipples. Option B, cheeks and nose. Option C, abdomen. Option D, limbs. Cholasma, otherwise called as Cholasma gravidarum or pregnancy mask. It is an extreme form of pigmentation around the cheek, forehead and around the eyes. It may be patchy or diffuse, disappears spontaneously after delivery. So here the answer is option B, cheeks and nose. Next question, a client is on magnesium sulphate therapy. For the repeated dose administration, the nurse need to check option A, urine output more than 30 ml per hour. Option B, knee-jerk reflex or present. Option C, respiration is more than 12 beats per minute. Option D, all the above. Toxicity of magnesium sulphate, BP decrease, urine output decrease, respiratory rate decrease, patellar reflex will be absent. So here the answer is option D, all the above. Next question, which of the following is the usual treatment for partial placenta previa? Option A, heparin therapy. Option B, induction of labor with oxytocin. Option C, activity limited to bed rest. Option D, blood transfusion. Partial placenta previa. Partial placenta previa means the placenta is partially over the cervix. Activity limited to bed rest, hydration and careful monitoring of the client's bleeding are the recommended treatment for a client with partial placenta previa. So here the answer is option C, activity limited to bed rest. Next question, adolescent pregnant mother at risk for dash complication during pregnancy. Option A, iron deficiency anemia. Option B, preeclampsia. Option C, eclampsia. Option D, diabetes mellitus. Most commonly observing complication among pregnant adolescent mother is iron deficiency anemia. So here the answer is option A, iron deficiency anemia. Next question, gravida 2 mother with O negative blood whose husband's blood group is B positive comes to ANC clinic. Which among the following question is most appropriate for the nurse to ask? Option A, how many ANC visits you had? Option B, what is your LMB? Option C, have you got anti-D injection during last delivery? Option D, what is the age of your first child? The mother is at risk for developing RH incompatibility. So question related to previous RH injection during the last delivery is appropriate. Usually, anti-D injection need to be given in the ANC period or 72 hours following the delivery. So here the answer is option C, have you got anti-D injection during last delivery? Next question, Babitha LMB began June 10. Her EDD should be which of the following? Option A, April 17. Option B, March 17. Option C, June 22. Option D, October 12. EDD calculated by adding 7 days and 9 months with LMB. So here LMB is June 10. By adding 7 days, we will get June 17. By adding 9 months, we will get March 17. So here the answer is option B, March 17. Next question, which among the following is the appropriate measure for reducing the breast tenderness in the first trimester of pregnancy? Option A, wash breast with warm water and keep it dry. Option B, wear tight clothes to support the breast. Option C. Expose the breast to air 2 hourly. Option D. Wash with soap and water 4 hourly. Washing breast with warm water and keep it dry will help to reduce breast tenderness in first trimester of pregnancy. So here the answer is option A. Wash breast with warm water and keep it dry. Next question. Identify the danger sign in the antepartum period. Option A. Vaginal bleeding. Option B. Blurred vision. Option C. Leaking amniotic fluid. Option D. All the above. Danger sign in pregnancy: sudden gush of fluid from the vagina, vaginal bleeding, abdominal pain, persistent vomiting, epigastric pain, edema of face and hands, severe persistent headache, blurred vision or dizziness, chills with fever over 38 degrees Celsius, painful urination or reduced urine output. So here the answer is option D, all the above. Next question. Which of the following prenatal laboratory test values would the nurse consider as significant? Option A. Hemoglobin 12 mg per deciliter. Option B. Rubella titer 1:5. Option C. Blood pressure 120/80. Option D. Proteinuria nil. Normal rubella titer should be 1:8 or more. A value less than that need medical care. So here the answer is option B, rubella titer 1:5. I hope you will enjoy this video. Thanks for watching.